We know that the brain tissue damage can occur when there is inflammation within the brain. However, there are studies that demonstrate that if there is inflammation in the body, in the system, or the peripheral inflammation is present in a person, the chemical molecules that are released as a result of that inflammation can go to the brain and activate the inflammatory cells of the brain, the microglia of the brain, and then the activated or reactive microglia in turn can cause many of the actions. Two of them are really dangerous. One of them is neuronal death, so the neurons are killed. And the second one is synaptic pruning, where they cut the branches of the neuron and cut their interconnectivity. The result will be the loss of cognition or reduction in cognition, the dementia's development, and Alzheimer's disease's exaggeration. The question is, how do these chemical molecules, how does interleukin-6 enter the the brain system or cause inflammation over there? So let's very quickly look at this study. So here is the study. It is published in Frontiers, and the published date is published online 2023, February 6. Association of Inflammation and Cognition in the Elderly, a Systemic Review and Meta-Analysis. So there is the mechanism over here in this study. They show three possible mechanisms of how the systemic inflammation affects the brain's immune system and cause inflammation in the brain. Number one, pro-inflammatory cytokines. Think about interleukin-6, C-reactive protein, tumor necrosis factor alpha, etc. So pro-inflammatory cytokines, transport proteins. So there are transport proteins within the blood-brain barrier that can pick up these cytokines from the blood side and move them into the brain. Facilitate active trafficking across the blood-brain barrier for central activity. So once these inflammatory molecules, the signals, the messages reach inside the brain, they would go there and activate the microglia of the brain, which would in turn do all the damage as I was discussing before. Number two, systemically generated cytokines may excite afferent nerves, for example, the vagal nerve, which send inflammation to the brain stem. Vagal nerve projects to the solitary tractus nucleus and higher brain area. So these are the brain stem and the higher areas in the brain. So when there is systemic inflammation, vagus nerve can become a conduit of bringing the inflammatory state to the brain. Number three, circulating cytokines reach outside the blood-brain barrier organ. So within the brain blood vessels, their cells expressing toll-like receptors react to the increased inflammation by releasing pro-inflammatory cytokines, which may reach the brain by volume diffusion. So now here the cytokines from the system, the body, have reached the blood-brain barrier. Over there the cells sensed them and the cells started becoming inflamed, which would of course cause inflammation within the brain tissue and as a result would cause damage to the neuronal system. So what is the lesson here? Number one, we should know that this can happen, that systemic inflammation would cause inflammation in the brain. And number two, we should do our best, our level best, to make sure that there is controlled systemic inflammation, if at all. If I was the one looking at the systemic inflammation, I think that the primary area is controlling glycation. Of course, the communicable diseases, for example, infectious diseases, can cause inflammation. However, non-communicable diseases, the most important factor, in my opinion, is glycation or control of glucose levels, control of diabetes mellitus, because glycation is underlying a lot of inflammatory states. So with this, thank you very much and talk to you again.